Welcome to my final project where we look at the effectiveness of a caffeine supplement for athletes. Caffeine began to be extracted around the 1820s. Presently, caffeine can be extracted from about 60 plants and also manufactured synthetically. Around 1821, caffeine was even prescribed as a medication to bring down fevers. Athletes commonly take 2 to 3 milligrams of caffeine per kilogram of body weight. Typically, this dosage is taken in a capsule or a tablet form, and it's taken 30 to 60 minutes prior to the onset of exercise to allow absorption into the bloodstream. Higher doses of caffeine are also taken. Some athletes like to take 6 milligrams per kilogram of body weight. However, as the dosage of caffeine goes up, more side effects begin to appear. So the 6 milligram per kilogram of body weight causes a higher urine output and may also cause a headache. If athletes seek to take 9 milligrams of caffeine per kilogram of body weight, the side effects become more severe yet. Tachycardia, anxiety, nervousness, stomach upset, and increased urine production could all result from that 9 milligram per kilogram dosage. Caffeine is commonly taken as a supplement to enhance sports performance. It may encourage dopamine release in the brain, leading to a diminished perception of fatigue and also a diminished perception of effort. Caffeine seems to work better for athletes in endurance type of sports, and it seems to be less effective for volleyball players or those that bench press. Caffeine has also been shown in studies to decrease some of that inflammation response that is generated after exercise. A study of recreational runners found that a caffeine supplement of 3 to 4.5 milligrams per kilogram of body weight did increase running performance by 1 to 2%. Caffeine's effectiveness in sports performance is due to a trifold response within lipid metabolism, more central nervous system stimulation, and less perceived effort. If the exercise duration is less than 20 minutes, lipid metabolism plays less of a role in the enhancement of sports performance. Caffeine's influence on adenosine receptors may be responsible for the beneficial performance response. Individual responses upon caffeine ingestion may be varied due to genetics, specifically due to the CYP1A2 genotype. Familiarity may generate a placebo effect in the participants, in that if they routinely take a caffeine tablet, if that's what they take during the study, they're going to expect the tablet to help them in some fashion. So if the mechanism of ingestion is familiar and routine to the athlete, there may be a placebo enhancing effect to that caffeine supplement as well. The caffeine effect was not as profound in athletes with higher baseline performance. Caffeine seemed to have a greater enhancement on sports performance in the athletes that were less conditioned or maybe had less ability. Around 74% of all athletes rely on some sort of caffeine supplement prior to training practices and events. Caffeine seems to increase the movement of sodium and potassium, along with the actions of calcium and fatty acids in the cells. Caffeine seems to reduce the athlete's perception of effort by increasing the adrenaline release. Regular exercise seems to increase antioxidant enzymes. The presence of these enzymes allows less oxidative stress to be experienced by the body. Caffeine itself causes vasoconstriction of the heart and brain, but it also causes vasodilation of smooth muscle. Studies have shown that caffeine appears to reduce insulin sensitivity. Indirectly, these actions may make caffeine an antioxidant resource as it combats inflammation associated with exercise and seems to have an effect on muscle hypertrophy. Caffeine seems to increase muscle tension by affecting noradrenaline, dopamine, acetylcholine, and serotonin. Literature summarizes the average dose for athletes is somewhere between 3 to 9 milligrams of caffeine per kilogram of body weight. The suggestion is that this supplementation is taken 30 to 90 minutes before the onset of exercise. Habitual caffeine use changes the way caffeine is metabolized in the body. So those athletes that tend to use caffeine regularly may have less of an enhancement in sports performance when they take a supplement prior to exercise. Caffeine seems to work best for endurance type of sports. A study that looked at a volleyball team found that the caffeine supplement did not carry any clinical significance for vertical jumps, agility, or a 30-meter sprint. Also, bench pressing individuals didn't see an enhancement either from the caffeine supplement. It didn't appear to have an effect on upper body performance, and there was no change for power output and bar velocity when the caffeine supplement was compared to the placebo. Looking at a comparison of study protocols, we can see that overall caffeine did seem to improve sports performance. However, caffeine did not improve performance for the volleyball players, nor did it improve performance for the people who were bench pressing. One study, though, gave the supplement close to bedtime. And that study's point was that caffeine has been known to cause difficulty in falling asleep and leads to more periods of being awake during the night. Exercise combined with a caffeine supplement close to bedtime could reduce the efficiency of muscle recovery. The wakeful state from caffeine is generated from the effect on A1 and A2A receptors in the brain. Caffeine also disrupts the circadian rhythm. So the point of that study was, if the supplement is to be given, it should be done for events earlier in the day. Because if a supplement is given closer to when the athlete is then going to go to sleep, their sleeping will be disruptive, and this could impair their ability to recover from events. There are a few contraindications for a caffeine supplement. If someone's being treated medically for anxiety, caffeine is probably not a good choice. Caffeine can increase the sense of anxiety, increase the sense of nervousness. And so if somebody's already dealing with that sort of condition, there's no reason to make it worse. If someone's being treated for heart disease or a heart arrhythmia, caffeine is not a good choice. Remember, at that 9 milligrams per kilogram of body weight, tachycardia and PVCs are a common side effect. So if someone's already being medicated for an arrhythmia, caffeine could just send them over the edge and make their situation much, much, much worse. If someone has ulcers or GERD, caffeine probably isn't a good choice. Remember, caffeine can cause stomach upset, so there's no reason to put more stress on that particular area of the body. Caffeine can disrupt kidney function by causing more urea to be excreted. So anybody that has liver dysfunction or kidney dysfunction already probably shouldn't compromise it further with a caffeine supplement. Any high doses of caffeine could lead to a seizure. And of course, pregnancy is a caution as well. Caffeine is an addictive substance. As with any addictive substance, once you quit using it, you could experience symptoms of withdrawal. Caffeine withdrawal symptoms could become noticeable in 12 to 24 hours after you have stopped ingesting caffeine. Mild symptoms would be anxiety, irritability, a little agitation, some disruption in your heart rhythm, or you could feel a little upset to your stomach. If you've been taking a large dose of caffeine, severe withdrawal is possible, which could disrupt your mood, even impact the blood flow in the body, and lead to some muscle cell injury. Withdrawal symptoms for caffeine continue to increase over a period of days, and then maybe after a week you're going to notice those symptoms diminish. But recognize with any addictive substance that you choose to take, there could be withdrawal symptoms. If you decide you no longer want to take caffeine as a supplement, the best way to avoid those withdrawal symptoms is to decrease the dosage of caffeine a little bit at a time. Instead of going cold turkey where you just quit taking caffeine altogether, it's best to work your way down on that dosage. And that will minimize the chances of you getting those withdrawal symptoms should you choose to quit taking the supplement. The Illinois High School Association does allow some caffeine to be in the body at the time of athletic events. However, if the urine would be tested and it is found to contain over 15 micrograms per milliliter of caffeine, there would probably be penalty actions taken against that athlete. Looking at college sports, they follow the same criteria as high school sports. Some caffeine is allowed to be in the body at the time of athletic events, but that criteria is if the caffeine present is 15 micrograms per milliliter or more, then there would be penalty action taken against the athlete. Looking at the criteria established by the World Anti-Doping Association, caffeine is not prohibited, nor is there a maximum threshold established for which beyond that a penalty action would be taken on that particular athlete. However, caffeine is on their monitoring list for 2021, so that could change in the future. Over half of all athletes experience GI distress during some point in their career. Dehydration, less conditioning, and being younger increases the chances of presenting with those symptoms of GI distress. Naturally, a full stomach isn't a good idea. Food intolerances, medications, nutritional supplements, alcohol, and tobacco also play a role. Illness and chronic conditions can contribute to GI distress. And of course, one of those nutrition supplements that might contribute to GI distress is caffeine. Diarrhea is the most common complaint from athletes when they're taking a caffeine supplement. However, there are a range of GI conditions that athletes may experience. Everything from reflux to gastritis to abdominal cramping to even lower GI bleeding. Many of these conditions can be helped by changes to the diet. As athletes exercise, up to 20% of blood flow in the digestive system becomes diverted to other parts of the body. 75 to 300 milligrams of caffeine ingestion prior to exercise increases the glucose levels in the blood plasma. It is thought that this increase in glucose in the blood plasma is one of the factors that contributes to the ergogenic effect of caffeine. However, should an athlete be hydrated properly? Should an athlete be trained well for the event that they're participating in? The study concludes that 150 milligrams of caffeine ingested prior to that exercise will probably cause limited GI distress. In reviewing caffeine as a sports supplement, we see that caffeine does seem to enhance performance for endurance type of events. Caffeine did not improve the performance for volleyball players, nor did caffeine improve the performance for people bench pressing. Habitual caffeine users had less of an increase in performance when they took that caffeine prior to an exercise event. And the reason for that is caffeine does create a tolerance over time. So if you habitually use caffeine, you will not get as much performance edge from a caffeine sports supplement. The optimal dose for caffeine seems to be 2 to 3 milligrams per kilogram of body weight, and that's taken anywhere from 30 to 60 minutes prior to exercise. Dosages of caffeine at 6 milligrams per kilogram of body weight does increase urine output and may give you a headache. If you take caffeine at a dosage of 9 milligrams per kilogram of body weight, more than likely you will see some side effects. You may see tachycardia, anxiety, increased nervousness, feel upset in your stomach, and notice a higher urine output. So 2 to 3 milligrams per kilogram of body weight seems to be the optimal caffeine dosage. And again, the optimal time to take that caffeine capsule is 30 to 60 minutes prior to exercise. Now, they do have caffeine supplements available as a gum. Often the caffeine dosage in that gum is not as high as what you would get in a capsule or if you take a powdered sort of drink. But the gum does allow you to receive the effect from that caffeine much sooner than if you would have to wait for the capsule to be digested and processed that way. The NSF, Certified for Sport, is a third-party monitoring agency of sports supplement products. The third-party monitoring agency makes sure that what the label says is in the product really is in the product. In addition, the monitoring agency ensures that there's no unsafe levels of contaminants in the product, and that the product does not have any of the presently 280 banned substances contained within it. The monitoring agency only endorses products that are manufactured at facilities that are regularly inspected. The two products listed on our screen here, the first one is a powder, the second one to the right is a capsule. Both of those products displayed have been listed as being approved by NSF Certified for Sport. The cost for caffeine is largely dependent upon individual preferences. It depends on how high a dosage the athlete really wants to take, and that's a determinant of the cost. The C4 product offers 30 servings for $19.99, and it carries 135 milligrams of caffeine with a single scoop. Now, Amazon offers a 200 milligram option of the powder, and the price then for that 200 milligram scoop is $69.97. So depending on how many milligrams of caffeine you want in your product, the price will go up as the dosage also increases. Now, Workout Extreme, that's not a powder, that's a capsule, and it offers 75 servings for $19.99. The capsule offers 140 milligrams of caffeine, but you need to take 2 capsules to get that amount.